Pasquale Venuti.
See you later. So, good morning. So, we'll spend 1 hour just finishing the direct parts, and then we'll move to indirect restoration to the vertical. That will be the main aim of the day. So, we were talking about caries, and I told you that even John Hunter realized that when you extract a tooth from the mouth, even a decayed tooth, you put in the garbage, the decay will never move it. It will be stopped. So the problem is not the tooth, but it's the mouth. So dental caries and caries lesions are not interchangeable terms, although they are often used as such. So we cannot remove dental caries. Dental caries is everywhere. It's a physiological process. We can only remove decayed tissue. So this is the consensus about caries. Removing bacteria from a cavity is no longer an aim of restorative dentistry. You have to fix this concept. So this is from the last consensus. There will appear to be little logic in the current practice of caries removal. It's neither possible nor necessary to achieve this. It does not prejudice pulpal health, and the caries lesion does not progress. You don't need to touch dentin at all, even if it is decayed. So for giving you any idea, this is an outcome-based reasoning, as I told you yesterday. These guys, Merz, Virus, Curtis, and co-workers, they followed up a lot of restorations just sealing the hole without touching the decayed dentin. That's it. They left all the decayed dentin there. And this is what happened after 10 years. They did 159 restoration, and they had just 3 failures. So that's normal. Even if you remove too much dentin, you have the same success rate. If you remove too much dentin, you have more failures because your teeth will need more root canal treatments and more post-op sensitivity. We need to remove dentin just for biomechanical reason, for supporting the enamel, not for biological reason. We don't need to remove any bacteria at all. So even today, hardness is the most reliable clinical approach to assess the dentin to be removed or left. Do not use any chemical approach because the colorant are not detecting the caries. Okay? Caries is everywhere. You should just remove the dentin that is enough for supporting your restoration. That's it. So this is when you see decay like this, you don't need to go into the dentin deeply. You just can cause sensitivity to the patient. That's it. Dentin is a vital organ. It can repair by itself. You need just to seal the cavity. You don't need to go into the dentin, just seal the cavity. So I tested a lot. So look at this case, okay? I voluntarily left that dentin, just for showing you what happens, nothing. I just feel this kind of tooth, okay? And this is after 2 years, okay? Nothing happens. So when we have this kind of decay, look, we have to eliminate all the decayed dentin that does not support the enamel. Okay, that's it. That's our main aim. This is what I did. This is on the second molar. Okay. I created support for my enamel, but I didn't go through the center of the dentin, because if I want to eliminate the dentin, I will go into the pulp. My tooth will suffer of gutta-perca insufficiency. This is a new pathology I see often. So this dentin is cheap, fast, available, a biostimulant. It's the best pulp capping material you can have. You don't need to eliminate it. You do your restoration. This is 1 year later. This is radiograph after 2 years. Decay cannot progress because you eliminate the gradient of the mouth. There is no gradient. Without the connection with the mouth, decay cannot progress. The bacteria are white. This is an old case of my father. Okay, I just removed this filling just for checking what is happening. Nothing. Okay, this is the dentin my father left 20 years ago. I have hundreds of these cases. Nothing happens. So I told you yesterday, decisions about caries are inevitably best guesses. So of course you should know that some decay can develop without detectable clinical cavitation. They are very rare, but they are. I found 3 cases till now in my practice. This is one of them. Look, these tooth changed color. But I cannot detect any cavitation, okay? Look what is inside, okay? Of course, if you want to eliminate all the dentin, you will be in the pulp, beyond any reasonable doubt. So this is one of my cases after 14 years. So what I did in this patient, I just filled some of the, what I considered cavities. Okay, I left some teeth without filling. So nothing happened. Sometimes I did too much. This patient didn't need any filling at all. Okay, this is iatrogenics at its best. I did. So, of course, when we prep the cavity, we should prep a cavity in a convenient way for our instruments. I will show one of the problems with axis of insertion of the matrix. So look, this is a random case on a social network. So if you have this kind of prep, you cannot insert the matrix without deforming the matrix because you have no free axis of insertion.